And welcome back to Square Off. Last April, Democrat Hiral Tipirneni nearly pulled off a huge upset in the West Valley's 8th Congressional District. The first-time candidate lost to longtime legislator Debbie Lesko by just 5 points in a district President Donald Trump won by 20 points. Now they are both back for a rematch in the November election. Hiral Tipirneni is a former emergency room doctor. She's also served on a health foundation board and promoted cancer research. Her family emigrated from India to Ohio when she was a little girl. Dr. Tipirneni, welcome back to Square Off.
Thank you for having me.
Want to let folks know Republican Congresswoman Debbie Lesko turned down our request for a debate. We do thank you for showing up.
Absolutely.
You lost by 5 points last time around, what, just 6-7 months ago. What's going to be different this time?
Well, you know, one of our challenges in the last race was really about name recognition. Nobody knew who I was. And we managed to close up that gap in just about 8 weeks. So we've obviously had more time to reach out to folks all around the community, talking to not only Democrats, but obviously independents and Republicans alike. And we're continuing to talk to them about the issues that are important to them. And those issues are the ones that we've been talking about all along. It's been health care, it's been education, it's been retirement security. These are the things that we've been focused on. So I know that we have a path to victory to close out that gap.
I want to talk about an issue that came up last time. I don't know if I dealt with it, but there was a question back in April about your emergency room service, a settlement of a malpractice lawsuit. And shortly after that lawsuit, you ended your day-to-day practice. Did that settlement force you to end your day-to-day practice? No,
and I appreciate your opportunity to clear it up. It had nothing to do with my choice to leave clinical medicine, and I didn't leave medicine altogether. I just left the ER. There was no disciplinary action, and obviously you always feel bad when there's a bad outcome for a patient, because you try to do your absolute best for every single patient you see. But that had nothing to do with it. I left clinical medicine because our family was deeply impacted by cancer. My mom and my nephew both passed away from cancer within just a few years of each other. And after that, it was a little hard to go back to the ER. My kids were little. I really wanted to spend more time with them. And I was fortunate to find a way to use my medical skills and my knowledge in a different pathway in cancer research advocacy, which allows me to also honor their memories.
Different question on health care. Do you support Medicare for all as a solution to health insurance, or we're taking steps toward Medicare for all?
What I support is universal coverage, meaning that every American has access to quality, affordable health care. And I've put together a very detailed plan of how we get there, because the other question is cost. We have to contain costs, and you can't address one without the other. So those have been my twin pillars, and I'm glad you're bringing this up, because my plan has been misconstrued often by my opponent. It is not a Medicare for all. It is a Medicare public option that is a buy-in. So what we do is we keep the parts of the ACA that we know work, including protecting pre-existing conditions, and then we also make sure we stop playing partisan politics with things like the cost-sharing reduction payments, which really rise premiums and throw the insurance markets into a spiral, and then we turn Medicare into that strong public option, have it compete in the marketplace with the private insurance players. What it does is it allows the free market to work. We have enhanced competition and therefore greater choice as consumers, and it drives down costs.
To the border, arrests have plunged more than 90% over the last 20 years, a fact that's lost on many people. But over the last 12 months, there's been a surge of migrants. The president wants to shut down the border to anyone seeking asylum. Do you support that? If not, how would you deal with this current surge?
I don't support shutting down the opportunity for folks to seek asylum within the guidelines of our legal system, obviously. But look, obviously we have to keep our borders secure. There's no doubt about it, and that is a priority. And that's why we have to stop kicking the can down the road on comprehensive immigration reform. It has to address all of these issues in a comprehensive way. Look, I've had the opportunity to go down to the border. I've spoken to Sheriff Estrada down in Nogales. I've spoken to Border Patrol agents, folks that work at the ports of entry. And what they've told me repeatedly is that they don't believe that a wall is going to help them. They want more manpower. They want more surveillance equipment. They want more technology, more drug sniffing dogs, more x-ray equipment. They need these tools, these resources to do their job better. And let's remember also that the greatest number of undocumented immigrants, the rising percentage that is the largest right now, are folks who are overstaying their visas. So we have to be smart and thoughtful of how we address our immigration issues.
What kind of Democrat would you be in Congress? More of a Kyrsten Sinema independent, or say a Ruben Gallego progressive?
I would be a Hiral Tipirneni moderate. because that's where I stand, that's where my district is. And I've shown that ability to reflect that, because in April, as you mentioned, we got to 4.7 points of a gap. And that's because we didn't just win with Democrats and independents, but we also got a large crossover vote of Republicans to come alongside us, because we've been focused on the issues. It's never been about ideology.
All right. Dr. Hiral Tipirneni, thanks so much for joining us. Best of luck in November.
Thank you for this chance to talk about the race.
All right. When we come back, Christine Porter-Marsh was the first of several Arizona teachers who jumped into politics to help our schools. She faces Republican Senator Kate Brophy-McGee, who says she's already done a lot for Arizona schools. Their debate next.